Hello my friend, and welcome back to my channel. My name is Eve. I am a former labor and delivery nurse, a birth doula, and a Catholic mama who is super passionate about helping other women achieve birth experiences that they will love. Today we are going to chat about how to choose where you give birth. I know that as a first-time mom, this was such a difficult decision for me. I was really caught between a hospital birth and a birth center birth. I toyed around a lot with both ideas before I finally landed on a birth location, and that was after a lot of extensive research. Technically, you could give birth anywhere, but in terms of planning, there are usually 3 locations that most women choose between: a hospital, a birth center, or a home birth. All locations have different pros and cons to consider, and I personally have a lot of exposure to all 3 locations and the differences between them, so that's what I'm going to share with you guys today. I want to start with a disclaimer that choosing a setting to give birth in is a highly personal decision, and it's sometimes also a really sensitive decision that depends on a variety of factors. So what is right for one mama might not be the best choice for another. As with every other decision when it comes to pregnancy and birth, you should be informed across the board about what all of these options are going to look like so you can make the best decision for you. We are going to talk about all 3 locations and different things to consider with each. I'm going to list these like pros and cons, but a lot of these things could be a pro to someone and a con to somebody else. So these are really subjective and dependent on the type of experience that you want. Let's go ahead and talk about hospitals first, because this is by far the most common birth location, especially here in the United States. Oftentimes when you're doing research, hospitals will actually refer to their labor and delivery unit as a birth center or a family birthing center, so it can get really confusing, but typically what is being referred to in that instance is actually just a labor and delivery floor or unit inside of the hospital. So to start off, we're going to talk about provider. When you give birth in a hospital, you could be seen by a variety of providers. You could either be seen by an OBGYN, an in-hospital midwife, or possibly even a family doctor that has a private practice and delivers babies. So what hospital birth looks like could vary widely depending on the hospital location itself, and then also the type of provider that you have within that hospital. Some larger hospitals or teaching hospitals might have access to more resources that a smaller community hospital might not. So for example, let's think of like a tub or wireless monitoring or birth balls. That might be available at some hospitals and not at others, which could really change what your birth experience looks like overall. You go through triage to determine whether or not you're in labor, if it's not, an induction, and then you'll be set up in a hospital room with a labor and delivery bed. That's pretty across the board with hospital birth. So some pros about hospital birth. Let's start with the most obvious, and that is going to be immediate access to medical resources. When you're giving birth in a hospital, you're probably going to have access to an operating room or a NICU or other medical resources in the event that some kind of an emergency were to arise, and that can be a huge upside for a lot of people. Now, technology can also kind of be a downside, and that's a whole nother rant or topic that we could talk about at another point. But for a lot of women, the access to technology in the event of some kind of an emergency can be really settling. Another pro of giving birth in a hospital is that you have a variety of pain relief options. So if you want an epidural, that will be available to you in most hospitals. If you want IV narcotics for pain management and don't quite want an epidural, that's usually available to you. You're going to have access to medical interventions when you're in a medical setting. Another pro of giving birth in a hospital is that they are totally in charge of setup and cleanup. When you give birth in a hospital, you're not worrying about having supplies on hand or cleaning up after the birth or setting up for the birth. Your team, your nurses, and other clinical personnel are going to be totally in charge of that. It's not even something that you have to consider when you're giving birth in a hospital. Another pro that I hear from a lot of women is that when you give birth in a hospital, because you're staying for multiple days afterwards, they kind of take care of you. I know some people say it feels like you're getting the royal treatment, and they will come into your room and check on you, get you diapers, help you with your baby, kind of get you what you need, and You're also having food delivered to you, which I know can be a huge upside depending on how good the hospital food is. But again, that could also be a con for some women because they do tend to be in and out of your room every few hours, doing things like offering pain medication, pushing on your belly, taking vital signs, etc. Some cons of giving birth in a hospital. Now again, this really depends on the type of hospital that you're giving birth at, but one of the major cons of hospital birth is that it does tend to be less personalized care overall. You won't always know who you are getting as a provider to deliver your baby, and you're also really unlikely to know your nurses in advance. And it can be really hit or miss. I will say the provider that you get and the nurses that you get when you are in labor and giving birth, if you get good ones, that can make a huge positive difference. But if you get ones who are not as supportive, that can also take a really big toll on your birth experience and kind of make a situation negative where it might not have been with another team. A huge con to giving birth in the hospital, especially if you want a natural birth, is that they have much higher intervention rates. So the sooner that you get to the hospital, the more likely that these interventions are going to be suggested to you or implemented. So some of those interventions include induction or augmentation of labor using Pitocin or other medications, epidurals, and cesarean sections. And then there's a whole host of other interventions we could talk about, but that's not really the topic of this video. But with the availability of medical technology, there is also a much higher likelihood of the medical technology being utilized even when it's not totally necessary. So I would say sort of a sub-con of that one is that they don't tend to be as supportive of natural birth as the other settings tend to be. It's a lot less likely that you will have the natural hands-off birth that you wanted in a hospital. Now, that's not me saying it's not possible, but you really have to set yourself up for success for that kind of a birth experience if you're going to be giving birth in a hospital. Another con of hospital birth is that there's just a potential for more stress because the sterile hospital environment with its beeping machines and bright lights and strangers can be really not the most conducive to labor progress and to an overall peaceful and enjoyable experience. Another con is that you have to drive there and think about when to leave and consider how far the hospital is from you. And not every labor is going to be textbook, so sometimes it can actually be really challenging to time that, so that's also something to consider. And then one more thing to consider about giving birth at the hospital, which is a consideration to some degree, regardless of where you're giving birth, but if you have other children, you're going to be in the hospital for multiple days, and so you're going to need to consider what you're going to do for care for your children. The next common birth setting is a birth center. Now, some hospitals do have true birth centers attached, but that is not going to be the majority. The type of birth center that I'm referring to here is called a freestanding birth center. So a birth center that is not attached to the hospital and is totally separate and its own thing. I actually had my first birth in a birth center, and it was a really positive overall experience. Birth centers can be a good in-between choice for mothers who feel like they want a more hands-off experience, but they don't quite feel comfortable with the idea of a home birth. So to begin with pro number one of a birth center, it is a much more comfortable and home-like environment than a hospital. Most birth centers do have a focus on natural birth, and they usually have a lot of resources to help you cope with an unmedicated birth. So like birth balls, usually they'll have a tub available to you. They're probably going to have a queen-size bed that's going to be comfortable for you to get into afterwards to snuggle your baby. And then it's not going to feel like this rushed, sterile environment where you need to check in through the ER and then go up to triage and then get settled in your room. Usually it's just a lot more personal and home-like. Typically, birth centers are staffed with midwives, and so you're also more likely to get more personalized care. Now, this isn't always the case, but most people find that midwifery care is a lot less rushed, especially during the prenatal period, and is overall just more individualized. Some birth centers have what's called a rotating practice, so they have a group of midwives that rotate call, and it's kind of a toss-up of who you get when you're in labor. But then some birth centers, you have a primary midwife, and they're probably going to be the one there when you deliver, unless they're at another birth or they're sick or something like that. The next pro is that they have overall lower intervention rates and better statistics. Where giving birth at a birth center are way less likely to get an epidural because it's not available at birth centers, and they're also way less likely to end up with a C-section. And then some birth centers have relationships with other hospitals in the area to make transfer smooth, and sometimes some birth centers accept health insurance, but this is also really variable depending on the birth center itself. Another pro of a birth center is that they do all of the setup and cleanup, so that's not something that you have to be thinking about. And because of that, you can still get that kind of home-like environment, but your birth partner or spouse doesn't have to be focused on setting up and cleaning up, and they can just be focusing on you during that time. Some cons of a birth center. They are going to have obviously less medical resources than a hospital, so there's not going to be an operating room or access to an anesthesiologist for an epidural. They're also not as suitable for high-risk pregnancies, so it's pretty easy to risk out of care at a birth center. If you want midwifery care, you usually have to meet a certain set of criteria. Another con is that you still have to make that decision about when to go there and drive there when you're in labor, and then drive back only. With birth centers, you're also discharged a few hours after having your baby, so that can be a huge pro to some people because they just want to get home. But that can also be a con for other women because then you have to drive home, and sometimes that can be really uncomfortable. I know it was for me on a bottom that just gave birth and had potentially stitches. Another con, which is also a con with home birth, is that the type of care can be really area dependent. So this might actually not even be an option for you if your area doesn't have any freestanding birth centers. Last, we are going to talk about home birth. Now, I just recently had a home birth experience and it was so amazing, but there are definitely some things that you'll want to consider before jumping into making that decision. So, pros of a home birth. I would say number one is going to be comfort and familiarity. When you're in your own home, that's your space. Your team is actually stepping into your space rather than you going to their space. Because you're laboring in your own space, that tends to be way more relaxing and less stressful. Another pro with it being your own space is that you have way more control and autonomy over the birth experience. When you're in your own home, you can eat and drink as much as you want and what you want. You can move around freely. You can birth in the water if you want to, get in the shower if you want to. There's not going to be anybody there telling you yes or no, you cannot do these things. Because it's your home, you're pretty much calling the shots. Now, obviously, if safety concerns arise, that's a whole nother issue. And hopefully the midwife that you have with you would tell you if something is a safety concern so that you can do the best thing for you and your baby. But if all looks good and looks healthy, you are the one making decisions and you're not answering to somebody else's rules. And then with a home birth, you are probably the most likely to get the most personalized care. Usually home birth midwives are midwives that are contracted to provide you that service throughout your pregnancy and birth. And you're usually not going to have a home birth where it's a rotating practice. So typically you will know the individual midwife who's going to be delivering your baby or helping you deliver your baby. And you're probably seeing that same person throughout your pregnancy. Another huge pro that is not the case with all home births, but with some home birth midwives, they'll actually come and do prenatal care and all your appointments at your house, which is amazing. Wasn't the case for my home birth, but I do wish it would have been, to be honest. And then I think that the biggest pro with a home birth is after you have your baby, you just climb into your own bed. It's amazing. You climb into your bed, they do whatever they need to do, the postpartum care there, and then you just hang out. You don't have to worry about traveling, getting back in a car, getting all your stuff together. You're already in your own environment. And so in my experience, the postpartum is so much more comfortable. You also don't have to worry about driving somewhere in labor or potentially having a baby in the car. And then another thing that I really loved about home birth is it just made it such an ordinary part of life. As somebody with the belief that birth is a normal bodily process, it just made it another day, and it felt so comfortable and reassuring to be in my own environment, and it didn't feel scary because it just felt like this was another day, except for I was in labor and going to meet my sweet baby. So I love that about having a home birth. Some cons. The most obvious is going to be that in the case of emergency, you would have to transfer to the hospital. Now, this is not as scary most of the time as people make it out to be. Usually the things that would arise in labor during a home birth causing a need for transfer are not emergent. The vast majority are due to cases of maternal exhaustion or requests for pain relief or other things that don't require access to an operating room right there in that moment. So usually it's not as scary as it could seem, but it's still really inconvenient if you're laboring at home. And this goes for birth birth center too. If you're laboring at home or at a birth center, and then you have to up and transfer to a hospital. Home birth is also not ideal for certain high-risk situations where a mom or baby have a health condition that might require more frequent monitoring. A huge and really unfortunate con of home birth is that it is not covered by the majority of health insurance companies. So most of the time when you're having a home birth, you will have to pay fully out of pocket. Now, overall cost-wise, birth centers and home births are actually way less expensive than giving birth in the hospital, but when it's coming out of your own pocket versus your health insurance, it feels way more expensive. What my family chooses to do is a health share plan. So we pay every month into this plan as if it were health insurance. And then whenever I get pregnant, I pay kind of like a deductible and they pay for the rest. So that's an option that you could explore if you want to have home births but aren't sure about affording it. Another big con with home birth is that most likely your husband is going to be in charge of some of the setup and cleanup, and that can just be less than ideal when they probably want to be focusing all their attention on you. You'll also still have to think about when you're going to call your team in, and I think that you have a lot larger margin of error with a home birth because you're in a safe, comfortable space rather than having to think about traveling somewhere, but you still do have to think about when to call them to come. And lastly, again, this is something to consider no matter where you're giving birth, but if you already have children, you're going to need to think about what to do with them and where they're going to go for care. Now, in theory, if you're giving birth at home, they could stay there, especially if it's overnight and they're going to be sleeping overnight, but it really depends on their ages and how comfortable you would be having them there, how big your space is, how self-sufficient they are, etc. So obviously, each of these options have their own set of benefits and drawbacks. And the best choice often depends on a variety of factors such as your health, your own personal preferences, and your availability of resources. But regardless of what you choose, it's still so important that you have all of the information so you can make the decision about where to give birth out of an empowered and confident place, knowing that you're doing the best thing for you and your baby. Ultimately, you do need to go where you feel the best and the safest, because if you don't feel safe in your environment, then you're probably going to spiral into a fear, tension, pain cycle, and we really want to avoid that, but that's another topic for another video. So let me know in the comments if you have given birth or plan to in any combination of these settings, and if you can think of any pros or cons that I forgot to mention. If you are expecting a baby soon, please know of my prayers for you. Don't forget to hit that subscribe button if you'd like to see more weekly content like this. Thank you so much for being here with me today, and I hope to see you next time.